Well, hello, everybody. And it's Teepa again. And I have a guest. And I have a guest who's going to participate in another one of our courageous conversations, really talking about living with courage, speaking out, advocating, having a message that's an important message. And what I love about it is it's a message we try to promote as well, which is there is no care without permission. And you've got to have a relationship for care to happen. I'm here to support. It's not my job to take care of you. So, Marianne, tell us a little bit about you, because first of all, you're not in the US.
No, I'm situated in Norway, and Norway is probably known as one of the richest country in the world because we have oil. And
And
even though
snow, you have
snow,
snow.
no, I'm
And
wearing this sweater now because we it's cold weather and yeah.
oh, and you have people who do great cross country skiing. And
I think it was like 40 medals in the Olympics.
it
It's
was like, wow, you folks in the wintertime, you take the gold medals left, right, and down the middle.
I was
And
skiing
yet,
yesterday, so
oh,
yeah.
were you? Oh, I'm about to go skiing myself, but it'll be very different. So, but let's talk about you're in Norway, you're from Norway, a wealthy nation, but that doesn't mean you don't get to get dementia over there and you don't get to have brain changes that impact your life in a major way and things don't happen. So, talk to us a little bit more.
Well, I have experienced dementia twice, actually, in my life. And the first thing was my grandmother. I lived with her
Mm.
while I was studying. And back in the days, they didn't have like the terms, the names for the dementia. They called it senile in Norway. So I lived with her for 2 years and I experienced her doing a lot of strange stuff. And of course, some years later, this is 15 years ago, my mother got the diagnosis of Alzheimer, an early phase diagnosis, which meant that we could, if the system had been perfect, we could have gotten a lot of help and she could live a good and prosperous life, or not prosperous, but she could live a good life.
High quality, good quality life, could have
Yes.
still enjoyed life, and
Yes.
you could have found some moments of enjoyment during that process. Yeah.
Yes. But unfortunately, even though we are a wealthy country and we have a very good healthcare system paid by
Hmm.
the government or through our taxes, so it's very safe and predictable. But within the field of dementia, not so much. So 15 years ago, we were sitting in the doctor's office together. My mom had gone through cognitive tests, and this doctor tells her that you have the early stage of Alzheimer disease. And she looked at me and she said, "And you, Marianne, you are the primary caregiver for your mom." And my mother, she just got silence. She silenced and she didn't ask any questions. And I started to ask a lot of questions and didn't get so many answers, but still it was like all about like, eat healthy, stop smoking, uh, have a good sleep, all those things. And when we went out of the doctor's office, my mom got this deadly disease that where you lose your identity and there was like no plan,
Yep.
no
Yep.
system, nothing.
Well, you had it. That was, yeah, yeah. Nope, nope. You're going to take care of it, caregiver. That's it. Yep. That's your job now.
Yeah. And back then I didn't know what to expect. I didn't know what to expect of the disease. I didn't
Yep.
know what to expect from the system. But like looking back, I'm appalled by this.
How is this okay? I mean, this is more deadly than any cancer diagnosis. We know that. But the number of years you might live and how you might live, not only your mom, but you. I mean, there is no consideration for, wow. So you're going to be living with Alzheimer's. Your mom is going to be living with it. And so let's talk a little bit about what that looks like and how that might play out for both of you.
Mhm.
No,
Because in the
that was not what happened.
Because the first couple of years, you're like, everything is like very unpredictable.
Mhm.
You don't know what to expect, and you just have to, whatever comes your way, you have to just handle it without any support. And then you go off after those years, you go into a chaos where like a lot of things are just happening, and you just have to like, juggle all the balls.
Yeah.
Um, and for me, it was just like experiencing all the things that happened to my mom, the hygiene was one of the first things.
Mhm. Yep.
My mother was really like, pretty woman, social, outgoing,
Mhm.
always dressed nicely, haircut like every third week.
Yep.
Suddenly she just changed, and when your mother starts smell,
Mhm.
of
Yep.
sweat, and it's like, how do you talk to your mom about those things?
Right. Yeah.
It was really hard. I didn't know how to approach things, uh,
Yeah. Well,
like
and
hurting
it
her.
sounds to me too, Marianne, that what didn't happen is you didn't get someone to say, so there's a couple of possibilities of why this might be going on. Let's talk about what the possibilities are and let's figure out which ones your mom might be experiencing so we can figure out strategies that would be more effective. Because it depends on what's precipitating or causing the change for her. And there's a variety of things it could be. So we should be curious about that, not just assume, well, it's just her dementia, it's just how it goes. It's like, well,
Yeah.
what parts are possible to do something about? And there are things to do if but if nobody says anything, it's like, could be initiation, could
Mhm.
be a sense she's already done it, she doesn't need to do it, could be that she resents somebody trying to tell her what to do, and that's a problem. I mean, but for all of those, I mean, I've been around for 45 years, 46 years now doing this work. And I can say in many, many cases, there's work things that we could do, choices we could make. If we know about them, that can change how this goes for us and your person. But, there's not that. I mean, it just doesn't come to you like that. It's not like somebody says, oh, by the way, here are the three things I want you to take a look for and see what you think. And let's talk about that. Did that happen for you?
Nope. There were no strategies, there were no plans, there were no aid, there was nothing that could support us in this. And my mother was ashamed of the diagnosis, which means she didn't want to talk
Yep.
about it. She didn't want anyone to know about it. She didn't even want to talk to me about it. So I had to be
Yep.
loyal and respect her wishes and just like, go with the flow and try to figure
Yeah.
out that we were going. And after a while, she got really sick living at home by herself, just like 7 minutes away from me. So I was
Oh,
trying my very best to take care of her. And
and
after,
respect the boundaries and still respect boundaries and not knowing, should I, shouldn't I mean, what can I mean, it just doesn't feel okay, but I mean she won't let me do other things. What can I do? Really lonely place to be.
since she was so ashamed, she
Mhm.
withdrew from everything, from friendships, from social gatherings, from her social. She was very social, but she didn't want to participate in anything anymore. So she got depressed. She got
Mhm.
lonely, isolated. So she was just like a shadow of my mom, and it was so like losing her
Mhm.
slowly was also something I just had to cope with. But at the time
Oh,
being, it was just like practical, just make day. And I was also a mom.
right.
I am a mom, but I got my daughter the same year that my mother got the
Oh,
diagnosis.
wow.
Like everything was happening at once. So I
Oh,
have no idea how I juggled all those things at the same time. I also own my own business,
oh,
and by the time that she got um, a place at the nursing home, I
yeah,
was emotionally burned out.
yeah, yeah. I
Yeah.
mean, that's and the sad part for all of us is that is such a common story. I mean, whether it's Norway, whether it's the US, whether it's Sweden, whether it's England, it doesn't, I mean, all over the world, this is happening because dementia is still a throwaway diagnosis. It is not a diagnosis where we really go, wait a minute, we need a care plan here and we need a game plan for everybody.
And
so what did you decide to do?
And you should think that like one of the richest country in the world, best social healthcare system is good at this, but we're not. We're not. It's the same challenges that we face. Our politicians does not understand the challenge of dementia.
And, and again, they keep backing, they go everywhere else but to dementia. I mean, they're, like this is what I think is the last civil right is to good care when you live and you are helping someone live with dementia. It's a personal right to care. And we are not supporting that. I mean, we really have so many ways in which we dismiss people as human beings and their care supporters as human beings that are being actively harmed by this system.
Hi, I'm Teepa Snow, and you just found our YouTube channel and watched one of our videos. I'm the owner and founder of Positive Approach to Care. Thanks for watching, and if you have a comment about, or you would, please share it with people you know. Oh, and if you haven't yet done it, consider subscribing. We'll let you know when the next new video comes out. And you might want to visit our website, www.teepasnow.com, where you'll find other resources as well. See you there.